John. Okay, welcome everybody. Out of deference for those of you who are here on time promptly, we like to try to start at the appointed hour. Welcome, and again, if you don't know me, my name is Alan Lewis, and I'm the Dean of the School of Health Professions. And I do appreciate you joining us for this lecture series that we're offering this year. And I'm wondering if you were here last time for the first kickoff lecture series, which was anticipating the future and building learning organizations. And we had a little bit of technical difficulty during that segment. And if you want, we did do a pre-recorded segment. And if you want to have access to that, send myself or Franchon Jackson, my assistant, an email, and we can send you that. Either if you were here and you didn't hear it clearly, or if you weren't here and you want to hear what we talked about during that session. That first lecture was on anticipating the future and building learning organizations. So tonight, we're going to talk about building key processes for continuous quality improvement. Building key processes for continuous quality improvement. Before we jump into that, let me do a few preliminaries. Let me say that, again, I thank you for joining us. The reason for doing this particular lecture series, which is really titled Skills Beyond Discipline-Based Expertise, is because here at Downstate, most of our students come with the exception of public health and some of the programs in the graduate school, and obviously not folks in the hospital, but most of our students on the academic side come and learn about clinical disciplines, medicine, nursing, and most of the professions in health here in the School of Health Professions. And it was my idea, and I've had this idea for a while, I actually had it in a previous institution, that we need to do something distinctive at Downstate that allows our students to have a little bit more in the way of horsepower and knowledge above and beyond what they're learning in their respective disciplines in terms of providing clinical services as practitioners. So that's why we're doing this session. And I've been doing this in the School of Health Professions since I've gotten here, which has been almost 6 years ago now, where I do a lecture in to each of our 6 programs, the students, a longer lecture than we're doing today that really talks about these skills. Because these skills, if you think about leaders in health professions and in health disciplines, they're expert clinicians, but they also have a set of skills that go beyond just being an expert at providing clinical services. And you can make the argument that these skills that we're talking about are some of those skills, things like leadership, things like building learning organizations, things like building key processes for continuous quality improvement, critical thinking, anticipating change, using data to make decisions, all of these sessions that we'll be talking about over the course of this academic year, once per month. So I wanted to give you again that big picture for why we're talking about these particular topics, because I think if we want our students in particular to leave Downstate prepared to not only be expert clinicians or practitioners in their respective fields, but to also be big influencers and leaders, we want them to have another set of broader overarching skills, and that's what these skills really are. So we're trying to evaluate these sessions. So typically, Franchon Jackson will send out a very short set of evaluative questions to those who attend. And please, if you would, take a minute, give us feedback, because we're always thinking about continuous quality improvement and trying to get better. And we can't do that unless we know what you think of what we've done thus far. And we do record all these sessions. So if you miss one or want to see it or hear it again, we can certainly make that available to you. So without further ado, oh, and the other thing I want to say is we typically do a 30-30 format, which is for the first 30 minutes, sometimes not quite 30 minutes, I do a lot of talking, and then for the second 30 minutes is when we have the engagement and discussions. So let's
I have a question. I attended the last one, but I never received the recordings from it.
Okay, so Franchon, you're here, right? Take note, Tatiana Alexis didn't receive it, and Franchon, and I just had
yes,
this.
I just put I'm sorry, I just put my email in the chat. Just send me an email and I'll forward the video to you. In the future, I'm going to make everything public, but right now I'm just sending it to individual people as you requested.
Okay, and you said it's in the chats, right? Thank you so much.
Just check the chat.
Yeah, thank you.
Jackson. Yeah, thank you, Tatiana, for letting us know that.
Thank you.
We do appreciate that. Yes, so tonight our topic is building key processes for continuous quality improvement. So we're going to talk about two things. Really, first of all, continuous quality improvement as the overall context within which we talk about key processes. And then we'll talk about the key processes and how you identify those and how you begin to build them in a more robust way so that they can approach being what we call zero defect processes, meaning processes that work flawlessly. And then we're going to end by talking a little bit about something called logic modeling. Some of you may be familiar with that. That sort of puts those key processes within a broader framework of how the organization works. So I'm going to jump right in and start talking. So the continuous quality improvement. You may have heard that term. Used to go by the term total quality management, also known as Japanese management. Started in the 1920s. It really hit its peak of activity and interest in this country probably from the 1960s up through the 1990s. So that 40 or 50 year stretch, it was very popular in this country. It still is to some extent. You don't hear quite as much about it now as you used to. I remember when I was working in state government in the late 80s and the 1990s, it was really a big deal. It was really a hot topic then. Everybody was talking about total quality management, continuous quality improvement. And so not as much nowadays, but some of the key thinkers in that movement in this country, obviously it emanates and derives from Japanese management, but the key thinkers in the United States are three persons. William Edwards Deming, you may have heard of him. He talked a lot about key processes. Joe Duran, who actually is, I think was from Belgium, but took up residence in the US and began to teach at several universities here and talked a lot about something called the Pareto principle, P-A-R-E-T-O, Pareto principle. You may be familiar with that, but that's a principle that speaks to causes and effects, and it says that inputs and outputs are causes and effects. And what it really says is that 80% of the output that we get, or the outcomes, or the effects in any given situation, typically are caused by a minority percentage of the inputs. So 20% of the problems we have, 20% of the people we have cause 80% of the problems if they're problematic in any way. So the Pareto principle says that it's a 20-80 split, and that 20% would be those inputs or those causes or those precipitating factors that lead to the 80% of the things we have to deal with, whether it's positive or negative, outcomes, outputs, whatever they may be. So Duran was a real big proponent of that and understanding that very clearly when you're doing a root cause analysis within an organization. And then a fellow by the name of Phil Crosby, who really talked a lot about building zero defect processes, that is processes that are 100% perfect and operate flawlessly. And he talks about getting it right the first time. So some of those are the leading thinkers in the total quality management, continuous quality improvement movement in this country. So today you do still hear about continuous quality improvement, but you primarily hear about it in two contexts. You hear about it, some of you have heard of the ISO 9000 standards, and that's the international. ISO stands for the International Standardization Organization. And 9,000, it's been several iterations. It started off at a lower number, and over the years it's gotten higher. And that's basically an accolade or an award that gets bestowed upon organizations that do a good job in quality matters. And so things like being able to have strong leadership. Those organizations do a really good job with relationship management. They do a good job with engaging people in their processes across the board. They do a very good job with managing their processes appropriately, which we're talking about today. And they do a very good job of making evidence-based decisions. So you hear a lot about ISO 9000. Sometimes you'll see that insignia on an organization's website, which means that's like a good housekeeping seal of approval in terms of quality operations that they've obtained by achieving that status based on those points I just mentioned: relationship management, leadership, process improvement, evidence-based practice, and that kind of thing. You also hear about the Malcolm Baldrige Award a lot these days. Some of you may have heard about that. Malcolm Baldrige, as an aside, was the Secretary of Commerce under President Ronald Reagan from 1981 to 1987. So this award was named for him. And this award, similar to the ISO 9000 accolade, really speaks to organizations that have obtained a certain level of quality across the board. And they 100 plus organizations per year get this designation, and they're in different sectors. So they're nonprofit organizations, they're educational organizations, they're medical organizations. There are many different types of designations, but they all are pretty good at being customer focused, valuing people, having an organization that learns, dealing with ethical practices, social responsibility, innovation, customer orientation, and visionary leadership. So in today's context, you hear primarily about continuous quality improvement in the context of the ISO 9000 award or the Malcolm Baldrige Award. But generally speaking, the total quality management, continuous quality improvement movement really is based on promoting quality within an organization and using the tools such as customer orientation, really making sure that you're focused on what customers want, cause effect analysis, benchmarking, looking outside of your organization across other organizations in the same industry doing the same, that have the same kind of mission you do, to see what best practices are, and building cross-functional teams to make sure that you're building these processes in a way that that makes them able to be not only interdisciplinary, but also as strong as they possibly can be, because they have multiple perspectives. They're not just unidimensional in how you think about addressing these key processes. So it really means, continuous quality improvement really means, in a very simple bottom line way, the idea of no matter how effective your organization is in its operations today, tomorrow you want the organization to be a little bit more effective than it was today. And each successive day going forward, whatever that, whether it's a day, week, or month or year increment, you want your improvement in your performance, you want your performance to improve over time. So that iterative, looking at how well you're doing going forward, and realizing that as you go forward, you're getting a little better each time you measure your performance as an organizational entity. So that's really the bottom line basic idea of the continuous quality improvement. So today we're talking about key processes as a key piece of continuous quality improvement within organizations. So within organizations, there are two primary commodities that are very important. Obviously, the people that operate the organization. No organization can exist without its people. The people are its most important and valuable asset, obviously. And then the other piece is those protocols, those procedures, those processes, those activities that the organization engages in that really allow it to do its work. So a key process really is, in a sense, the sort of the operational definition of what an organization, how it does its work. And so there are many key processes that speak to how an organization does its work. And a lot of times we think about managing those processes in a way that that we want to measure them sort of statistically. And so within TQM, Total Quality Management, Continuous Quality Improvement, there's something called statistical process control. We're not going to dig into that today, but there is a set of methodologies that speak to how you manage the effectiveness and performance of a given process statistically over time. And that's a much more quantitative approach. Today, we're taking a simpler approach and thinking about identifying these processes, defining the processes, identifying what the key processes are, and building those processes in a way that allows them to approach being a zero defects process. In other words, a process that's flawless in the way it operates. And the idea is that you want the process to operate each and every time it gets invoked the same way in a very standardized kind of manner. And the problem with the reason these processes don't always automatically work flawlessly, automatically or zero defects, is because the people who are implementing the processes, the people who are facilitating the processes are us, and we're all human beings. So the process doesn't happen without some human interface. And so that human interface is what gives it the fallibility that we see, and the likelihood that it will go astray and not be the process that we expect it to be. So the idea is that any organization can build a key process that is 100% effective every time it gets invoked or facilitated, if it builds in enough safeguards in the process, so that the process is robust enough so that those places in the process where human beings have interface and influence over how the process works are protected with the safeguards on both sides. So the human beings essentially can't mess the process up. If you build a process that depends on me or Dr. Ote, I see her in this discussion, or Dr. Gerard having a perfect day each and every day, then that process is doomed to fail, at least in my case, because I may have a perfect day once every 100 years, right? So that means I'm never going to have a perfect day because I don't live to be 100 years old, probably. So as human beings, we ebb and flow based on our motivation, our effectiveness, and how we do things. You know, come in, we don't feel as good one day. So there's a lot of variation when you have human beings in the picture with these processes. So the idea is to build that process in a way that it doesn't rely on any one of us having a perfect day, because that's a very dubious expectation if we expect that. So you can think about key processes, and most of us can identify those if we are familiar with working in a particular unit or work setting. We pretty much know what the key processes are that operationally define how we do our work. One way to think about it is think of the mission of an organization and what are the things that contribute to that mission? What activities, what processes contribute to that? So a key process is I'm going to read a little definition here, is a protocol or a procedure or a way of doing something that is important for the organization to accomplish its mission. The process should be standardized, which I already said, meaning the goal is for it to happen the same way every time the process is invoked. So examples of key processes, I'm sure we have a few people in our conversation today who are from the hospital side. So patients accessing the ED or the ER would be a key process. The intake process, when a patient comes and goes through the process of being admitted to the hospital, that's a key process. The triage process, when a person shows up at the ED and you got to figure out what kind of care they need, acute care or something maybe less urgent than that. Discharge planning, and the list goes on of the many types of key processes that a hospital organization will engage in to do its business. On the academic side, there are things like admissions, curriculum reviews, accreditation preparations, student clinical placements. Those are all key processes that we engage in on a routine basis that really do operationally define how we do the work to accomplish our mission as an organization. So when we get to the second half, our discussion component, we'll be able to have a conversation about some of the key processes that may interest you, and we can talk a little bit more about those in specifics. But again, that assumption is that people are fallible, and therefore people involved in processes, and they are in all organizations, then the process has a lot of room to not be a perfect process. So let's talk about steps in identifying a key process. And to do that, I'm going to actually try to share screen and look at a couple of PowerPoint slides. So keep it in mind that we're talking about building a process that's strong and is robust enough with enough built-in safeguards that the process can work flawlessly every time without fail. So to identify or define a key process, you have to have a process that you name. So we're talking about the intake process in a hospital, for example, or the clinical placement process on the academic side for a given clinical program. And so it should be a process that's utilized repeatedly and is part of the essence of the program's operations. Then you want to identify the starting point for that process. When does the process actually start? What's the very first step when that process gets invoked and starts to be implemented? You want to also then identify the endpoint for the process. And then you want to identify all the steps in between the starting point and the endpoint for that key process. And then for each step that you identify in step 4 there may be several options on the outcome. So it'd be good sometimes to go ahead and identify those proactively, just so you know what the outcomes are at each step to kind of keep you grounded in what this process is trying to do. So it's very simple. You have to name the process, figure out the beginning point, figure out the end point, and then all the steps in between the process. If that's a process that's fundamentally important for your organization to meet its mission, and you can identify the name of the process, the beginning point, the end point, and the steps in between the beginning and end points, you've defined and identified that key process. So then what you want to do is to think about how we want to strengthen the process. And so strengthening a key process is really pretty simple. Once you've laid out that process in a way that you understand exactly what it is, the name of it, its beginning point, its end point, every step in between, then, and you've got some outcomes tied to those steps, then you can strengthen the process through another set of steps. So I've laid out here a 7-step approach for strengthening this key process. First, identify the steps in the process, step 1 here, that are subject to variation, especially due to human involvement. So if you got a step in the process that doesn't require any person or any individual to have their hands on it or in it in any way, then you don't have to think about trying to make that piece of the process stronger. But any step in the process that has human involvement, you want to look at that and add in step 2, add safeguards to the parts of the process that rely on human factors. So if it's a part of the process that requires me to make a judgment, or for me to be 110% on my game that day in terms of how well I'm functioning, then you don't want to rely on that in and of itself. You want to have another person who reviews that, or have another safeguard that backs me up, so that if I'm faulty in how I make an assessment or perform my task in that process, there's another point in the process that catches that and makes that correction. Then you want to pilot the so you do that for every step in the process, that has that human involvement. So it's not complicated. You identify the process, beginning point, name it, beginning point, end point. It may have 3 steps in between, it may have 10 steps, and maybe have 50 steps in between. Look at all those steps, any steps that involve humans, think about what could go wrong, and then build in for each of those steps some additional measures, safeguards, points of insurance to allow that person to be backed up and not have to rely on that person having a perfect day every day, because it's not ever going to happen. But that person's going to be perfect on every day. And you build those safeguards in, so you make the process much more robust in that way. Now, you got make the argument that you're making the process, more, longer and more burdensome and more, bogging it down with the extra steps. And in some sense, you are. But what you want to do is, after you re-engineer this process, go back to it and try to streamline it as much as possible to keep some safeguards in place. So step 3, pilot the new draft process. And then I suggest doing the same thing, those same 3 steps all over again. So step 4, again, identify the steps that are subject to variation due to human factors. Step 5, add safeguards again to the process that involves those human factors. And step 6, test a newly improved process, but this time, not so much in a pilot, but also in a real world situation, a real live, beta test. And then tweak and implement this new key process as much as you can going forward. So you'll know the redundancy. So it's really only 3 main steps. Identify the steps that involve the human involvement, add safeguards to each of those steps, and pilot the process. But I suggest going through this at least twice with every process to make sure you haven't missed something, so that redundancy gives you an added level of protection and insurance that you really thought about this process in the best possible way. You've identified those human factors, and you've begun to nullify those human factors based on whatever safeguard or safeguards you put in place to either nullify them or neutralize them as much as possible, so that your process begins to approach being 100% zero in terms of its defects. So 5:20. Now let's shift gears a little bit. This is not rocket science, and let's talk a little bit about key processes within the context of a logic model, which allows you to understand not the process in the abstract, but it puts it into an organizational context in terms of what those beginning resources are and what the process actually leads to in outputs and outcomes. Was there a comment there?
I gotta get Junior.
Okay, maybe somebody else is talking. Yeah, please mute if you're not talking to us. Okay, so let's move to the logic model part of our discussion. So the logic model, and many of you may have heard of this. The logic model is a tool that's used. I do a lot of logic modeling in my leadership and management responsibilities. It's a tool that came out of the manufacturing environment years ago, I think 70s or 80s, that really has talks about inputs and activities and outputs and outcomes. But the logic model is a great tool to really, in a glance, understand how a program or a service or a process is supposed to operate. Because the logic model starts with what we call raw materials or starting resources. Those are the inputs. Those are the things you have before anything happens. And then you have activities or key processes. And these are the things that really operationalize how the organization functions to achieve its mission. And then you have outputs. And outputs really would be the yield of things that result from these activities having taken place. So the outputs would be basically a process measure or implementation evaluation measure that speaks to the fact that you've actually implemented these activities, and it also allows you to speak to whether or not you've implemented them in a high enough threshold to achieve a dose that's adequate enough to expect to see an outcome on the other side. And the outcomes really are the impacts, the benefits, typically in terms of people who are recipients of this service or program, in terms of whether they've gotten anything of value from it. And so if you think about the inputs, the key processes, or sometimes called activities, the outputs, which is really the productivity or the yield or the dosage of what you've done, and then the actual outcomes, the impact and benefit on end users. You think about the first 3 pieces really being formative or implementation evaluation, and then the last piece really being summative or impact evaluation. And so the logic model is a nice way to really encapsulate the essence of what your program is supposed to be, in a 1-page, at a glance, somewhat visual depiction that has these 4 components in it. And then it also gives you a beginning point on understanding what the evaluative piece is, because quite frankly, these first 3 pieces, inputs, activities or processes and outputs, are the formative evaluation, and this last piece, the outcome, is the summative evaluation. So in a minute, we'll talk about how you can back up through the model, through the logic model, and kind of see what's going on with the program. But this is where we're focusing today, is really trying to look at how we make these processes stronger, and so they can approach being a zero defects process. And the point of putting it in this context is to see that these processes don't stand in a vacuum, in isolation. They are impacted by the raw materials or starting resources that we have to begin the work if we're providing a service or operating a program. And then these processes result in some things that happen as the yield, either the outputs or the outcomes, which are more downstream. So now I'm going to pull up another, stop sharing screen now, and pull up another thing, which this is an article I did in 2009 on the logic model. The logic model of vocational rehab program manager's best friend. And because it's the best friend, because on the one hand, it depicts what the program is supposed to do at a glance, one page, big picture, and it also begins to give you a running start on your evaluation components. So let me go down, and my point in showing you this is to show you a couple of models that I used in this article to kind of give you a sense. The one that we just looked at in the PowerPoint was sort of a bland model, didn't have any real detail, just kind of talk conceptually about what's in those four columns. So here's a general template, which is what I just talked about. The inputs, the resources of raw materials, what are the basic tools the program has at the start, the activities, strategies, or key processes, what are the key activities that operationally define the program, outputs, the products of the program delivery process, how do we know you provided the services, the yield or the byproducts of the program confirming that it has been delivered, that the service has been delivered, outcomes as evidenced by program participants, what confirms the program was effective or ineffective, if that's the case. So that's the generic template, similar to what I just talked about in the PowerPoint slide. And let's move on down to an actual example or two of a logic model that, okay, so here's a logic model. The orientation is a little more, is more vertical than horizontal. And you see instead of inputs, activities, outputs, and outcomes across horizontally, I did it this way: inputs, activities, outputs, and outcomes vertically, but it's the same information. So this is a logic model for a job placement program. So a program that has the mission of placing persons into jobs. And this is in the context of rehabilitation, where you're working with persons with disabilities, trying to get them back to work. And so the inputs for this would be the staff. These are things you have before you provide your service. You have clients, you have job placement slots, you have a program philosophy or curriculum. And then these are the key processes, so the activities. So you have an intake, that's how people get into the service. You do some type of evaluation of them vocationally to see where they are, what the skills and interests may be. You train them in something. You do work hardening and work adjustment because they're trying to go to work. You place them and then you follow up. So each of these 6 bullet points here call activities, but these really are the key processes. So what you would do is you take each one of these, intake by itself, vocational evaluation, and go through those steps of saying, okay, name it. The name is intake. Beginning, the first step, the beginning point, whatever that is. The person shows up and says, I want a service. End point, when the person is discharged, perhaps. And then what are all the steps between, well, when the person referred to the service would be the end point, not the discharge piece, that's further down. And what are those steps in between that beginning and end point in this intake process? And then you think about which of those steps, let's say it's 10 of them, involves human beings. And each of those steps that involves human beings, you're going to try to build in some safeguards so that the process can actually approach being zero defects. In other words, being flawless. And you do the same thing, same process of naming, identifying the first step, the beginning point, the end point, and the steps in between, and the human factors involved in the steps for each of these processes. Because these are the 6 key processes that speak to this particular program. So you kind of get the idea. And so this allows you to see these processes within a broader framework. They're not just in isolation. They lead to some outputs, number of persons enrolled, number of persons that complete each discrete pre-placement program phase, evaluation, training, work hardening, adjustment, etc. And then the outcomes will be these kinds of things here. Number of people who are placed in job slots, number of people who remain on a job for a certain period of time, number of people who remain on a job, long term. So it's important to have a broader perspective on what these key processes would be by putting them in this logic model framework. And so here's a more macro perspective for an entire VR agency. The inputs, and here are the key processes: case finding, eligibility determination, information referral, voc evaluation, education retraining and voc preparation, case management, counseling, job readiness and work hardening, job placement. each of these key processes would have to go through that same 5-step process of determining what the name is, which you've got the names already here, what the beginning point is, what the end point is, all the steps in between. And then as you're building it out to be a better process, you got to identify those human factors in each of those steps and neutralize those by building in safeguards so that they don't rely solely on the human factors. And then one more example, and we're almost out of time. And yeah, and so the difference between this one and this example, the one we just looked at, is that this one actually has some evaluative questions included. So for the inputs, in addition to having what those inputs are, it says, is there a need for a programmatic intervention? And for the activities, in addition to having these bullet points here, which are the actual key processes that you're going to improve and make them a zero defect process, you have the question that says, what service is provided? And then the outputs are here. And as a result of case finding, eligibility determination, who was served. So the who and then how affected. So that's it. So let me think. I said I was going to say a little bit about backing up to the model. So the key with the model is, and this is getting a little bit ahead of ourselves. So I'm going to talk about evaluation, data-driven decision-making later on. But when you have this model with these key processes here, go back to the more bland example of the model. When you get to, when the program's operational and you see a set of outcomes here, if these are not the outcomes you're expecting to see, in other words, you don't see that your program is actually having the desired effect that you expected it to have, then the first thing you do is back up. Okay, first of all, the first question is, if you're not seeing the outcomes, then are these the right outputs? Is this yield correct? Is the yield in a great enough magnitude or dose to expect to see these outcomes? A lot of times you have a yield here that doesn't meet the threshold that you need to meet in order to expect to see an outcome. If you don't have people participating in the program enough sessions, then you may have some outputs, but they're not in it enough to actually get better in terms of the outcomes. But if these look fine, the dosage looks good, the yield looks good in terms of how productive you are, and invoking these activities, and you back up and say, okay, well, are these the right key processes? You know, this is sort of theory of change. We have this set of key processes, but are these key processes going to lead to the outcomes we're talking about down here? Sometimes we're doing educational things here, and we're expecting behavior change over here. So that means we need to have some key processes that are also focused on behavior change. So that's what we think about, whether the theory of change is aligned with these key processes, implicit in these key processes, to actually ensure that we achieve these outcomes downstream. And then sometimes you say, well, these are fine. These are on target in terms of the theory of change that we're trying to embrace in this program model or the service model. But then you say, okay, do we have the right resources? Are we starting with the right materials? Is this the right curriculum? Do we have the right people engaged? Do we have the right equipment? You know, we have all those things that are more physical plan and, you know, conceptual in terms of how we start this process in terms of raw materials and starting resources. So that's how the model not only depicts how the program works when you have it set up, and you can see what the formative and summative evaluation components are. Then, as a practical matter, once your model is fully developed, you can actually look at the outcomes and begin to back up through the model, go the opposite direction, and kind of begin to test out some of the evaluative pieces and see how well the performance is in terms of your program. But again, the key to all this is that we're looking at building these key processes here in a way that makes them as robust as possible and rely minimally on the human factors that are going to be involved in every process within every organization that has human beings, and therefore they're going to be subject to being fallible. So we want to minimize that fallibility. So I think I've hit the 30-minute point, maybe a little beyond that. And let me stop and let's segue over to the next component of our time together, and let's have a conversation about what we talked about. Any questions, comments, points of clarification, points of difference, or agreement, whatever you want to say. Let's throw it into the mix.
Yes, I wanna ask a question about the Parado principle, the 80% or 20, yeah, split.
Yeah, that's a total quality management, continuous quality improvement principle that Joe Duran put forth, and again, the point of that is to realize that when you typically and often when you're doing a cause effect analysis, a root cause analysis, you know, you find that there's a minority of factors, the 20%, that accounts for the majority of the output that you get, whether they're problems or they're positive kinds of things, and that's the 80% factor. So that really just speak to the proportionality that you see in terms of inputs to outputs in most organizational settings. Now you may disagree with that, but that's really what the Pareto principle speaks to, is that there's typically a 20% allocation of those things that speak to a 80% yield, or the outputs that you see in the organization, whether you're talking about positive outputs, good things that you want to see happen, or problems. And I always think about it, within any organization, you think about it. It's 20% of the people who account for 80% of either the success or the lack of success in any given organization. So to me, that's a real world example that makes it clear to me. It's those 20% that either because they overperform and they're doing excellent work, that equates to the 80% positive outcomes, or because they're underperforming and they're disruptive, that leads to the 80% of the problems your organization may actually have. And so that's what that rule really speaks to. As I said, you may or may not agree with it, but that's what the Pareto principle really does. That's how the concept behind it, quite frankly. So do you have a follow-up question to that?
Yes, I'm okay with it.
Okay, great. Good question though, yeah, good question. Now, what do you think of that rule? Do you think it's true or not in your experience? Do you see that minority factors that account for the large outputs?
So I'm not sure. I think I agree with you right now. I see it because I didn't understand it at first, but I got it now.
Gotcha. Okay.
But I don't think I have any experience from it.
That's
I
fine.
would say.
Yeah, I was asking your observations and your experience, but you've not maybe thought about it like that before. But
yeah.
The key is the 20% would be the inputs, the causal factors, and the 80% would be the outputs, the things that result.
Yes, it's true.
So, yeah. But that's really a total quality management. Basic tenet as put forth by Joe Geraint, who was one of the leading thinkers in this country on that. Somebody had a comment. Go ahead.
Yeah, hi, my name is Marcia Lamarck. So yes, in my both professional life and personal life, I would say at work, even in my area, I do see, yes, with the 20%, like 80% rule, like even with success, you will see some of the employees, they're really the one who are really there making the unit runs. Either they're always showing up to work on time and getting the report and actually supporting the rest of the staff who's not coming in on time. And right. And just getting the work done and then saying like, okay, I got this report for you, this needed to be done. Yes. And even personally at home, even in my own house, I would say the 20%, 80% rule. You always have either a member of the family, even their chores, they're not doing the chores. Right. Okay, so you have somebody else who's always helping them out. So yes, I do believe in the 20% or if 80% rule, even if when you go on vacation. Right. Okay, so I could go on and on. Yeah.
And those percentages are not in stone. It could be 25, 75, but the point is, a minority of the effort results in a majority of the outcome. And I think about it, and it comes to life for me when I think about, maybe because I'm older now, but I think about people who in my generation who have advanced age parents, parents who in their 80s and up, and they and in these families where you may have 5 siblings or 5 kids that from that parent, and you have only one of those kids is really helping that parent out. The other 4 are sort of hit and miss. They may be involved here and there on an episodic basis, but you can only depend on really 1 or 2 of them, sometimes just 1, to be there for their parent. So it's almost like a principle of life, so to speak. So you have this group that either overachieves or underachieves, or whatever way they achieve, however they perform, it results in a big impact on the other side where the outputs are. So.
What one colleague had explained to me many years ago, like how to get that work, because she had explained to me not so much, like she didn't even say the Pareto principle, but again with the 20%, 80%, what she told me, what you got to do even with the staffing is those who do not really work are so productive, kind of put them together and then you'll get something out of them.
And you get something out, yeah. Yes. Let them complement each other a little bit in terms of how they work. Absolutely. Yeah. So, yeah. Shirley, I'm trying to see if, Shirley, I see you just had a question there. Can you say it in the chat? I missed it. It was kind of up there. I know it had to do with 20 neighbors. And let's see here.
Yeah, I'm just saying that I don't really want the 28 rule in my work life or in any of my lives, actually.
Well, right. Yeah, I think it's a fact of life by default, but I don't think it's the optimum that we want to have play out. Is that what the point you're making?
Well, yeah, but I mean, we can't allow that. That's why we have so many problems. We can't have a few people, the ones who are running and making everything work, and the rest of people just sliding. That's not how society can be most effective.
You're right. I couldn't agree more. If we could have more participation on the input side, then we could get, I mean, society has a lot of ills and a lot of problems today, as we can all attest to just looking around in 2021. But if we had people who were, everybody was pulling their weight and contributing closer to what their potential would be across the board, we'd be in a much better place. Absolutely, absolutely. But this is a sort of a theoretical thing and I just looked it up again. The person who put forth this principle is a fellow by the name of Vilfredo Parado. And so you have to kind of read up on him, but this is sort of based on his thinking about this. And I think, sad but true, in many cases, we can see evidence that this is how things operate. And again, it's not what we want. We want to strive for much more balance than that, quite honestly. But we're not quite there yet, probably. But any questions about the thing about key processes in terms of how we can build a process to make it a better, potentially more perfect process by addressing those human factors and building those safeguards in? And I was thinking maybe somebody would have an actual process that they want to throw out for us to strengthen, but it's up to you. Anyone? It's pretty straightforward, pretty commonsensical, you know. You got a process that has 6 steps, and of those 6 steps, 4 of them involve persons. So obviously those 4 steps that involve people having to do something are going to be somewhat compromised on any given day. So if you can minimize the extent to which they rely on a human to perform optimally, then by building in a safeguard or two, then obviously your process gets better. And that's sort of the bottom line idea of what we talked about. And the continuous quality improvement, total quality management, Pareto principle, all those things really are context for how we've come to really focus so much on these key processes. But the key processes is really the main point that we want to emphasize today. They want to build those processes, those activities, those protocols, those procedures that are the operational definition of how our service or program runs or operates. We want to build those in the most robust way possible so that we can have a process that's standardized and doesn't rely 100% on a human being being on their game all the time, because that won't happen. And the logic model is just another way to think about that in a broader context. And we'll talk maybe a little bit more about the logic model when we start talking about data-driven decision-making in one of the later segments with this series. Maybe I'll use a different model. There's another model I like to use too. They call it the SIP model. That's similar to that. But anybody else have a comment or question or point of difference or agreement, observation, or anything we've said today? And those of you who were in today's session and last week's session, last week was the pre-recorded, today was the live session. Which one do you prefer? Which one was better from your point of view in terms of me doing a pre-recorded session for the first 30 minutes or me just doing a live delivery for the first 30 minutes?
Live is better.
Okay.
Life is better.
Right. Well, Franchon, my sister, have been telling me that for all last year when we did the other segment on the soap Dean's Lecture Series on culture. She kept telling me, let's do it live. And I'm not opposed to live, but the problem was we had some technical issues. So we said, if we just do it ahead of time, then we can have a pre-recorded session, then we may minimize the technical issues, but we saw that's not always true. So going forward, I think I'm gonna try to do live more than the pre-recorded, or maybe entirely. Anybody else? I'm not a fan of holding people just for the heck of it. We can end early, but we do have time if somebody wants to make another comment. Last question. Go ahead. Hello?
Once they got, they're gonna leave somebody else to pick up the child?
Now, was that a question for us here in the group?
I don't, hello?
Yes.
Hi, I don't have a question. I was just wondering, is it possible that you could put the article that you, the
Sure.
logic model article that you wrote? Because
Yeah.
you were talking about the slides, but I didn't see the slides, so I wasn't sure if you posted the slides while you were doing the talk.
I didn't, and I can, it's only 3 slides, and it was just these 3 slides, which was the steps in identifying the key process,
Okay.
steps in strengthening the key program. I can make this available, and then the logic model, and then of course I got the article that I showed you, and I showed you a couple examples. So what we can do is, Franchon, can we just send those 2 pieces to everybody who was here today?
Yes, we can.
Dean Lewis,
Yes.
we weren't seeing the examples that you were referring to after you showed us the logic model.
Yeah, that's what I was talking about too. I didn't see.
I was trying to alert you in the chat, but I don't think you saw me.
Let me see.
The slides from your article.
Oh, you didn't see that? Okay.
Right.
Shit, now you see it, right?
Yes, now we see it. That we weren't seeing that before when you were talking.
Oh, you weren't seeing it? Okay, yeah.
I sent you
Probably it's hard to keep up with the chat and talk at the same time, but let me just do show you real quickly all right, so this is the article. I did it, a few years back, 2009, and what I did is I showed these 3 examples. This is a reinforcement of the PowerPoint, which is a generic template. You'll see it when I send you the article, so you can look at that. But what I really zeroed in on were these couple of examples, which was, this is one for a job placement program. Then you see it now, you see the input, the staff, the clients, the placement slots and jobs, program philosophy. And these activities really are the key processes: intake, voc evaluation, training, work hardening, work adjustment, placement, and follow-up. These are the things that you're going to go take through those 5 steps to define the process, then those 7 steps to make the process more robust by building in those safeguards. And the whole point of the logic model is to put it into a broader context, so you don't have to think about these processes in isolation. It fits into the resources that you have to start the program or service, and it leads to these outputs, which really would be the yield or the dosage kinds of concerns and then the actual outcomes. So I suggest using a logic model approach, because that allows you to put it to a broader framework. And here's another one that I showed you, which was a macro view of a logic model for a state book rehab agency. And again, you have these activities, which are the key processes that you didn't see when we went through, but here they are: case finding, eligibility determination. So each one of these would be a key process that you then take to the apply those 5 steps to define the process, name it, which the name is already here: beginning point, end point, steps in between. And then when you're going to improve the process, you're going to look at those steps and figure out which ones involve humans, the human factors, and build in some safeguards to make those human factors less likely to go awry, because human beings are not going to be perfect. But again, these are all those processes that would be involved in the macro view of how this agency operates. So yeah, I'll send this to you. And I didn't realize when we're going through that you were not actually seeing this. I'm just as busy scrolling down this, but I guess I didn't hit the share screen in a way that you could see it. So yeah, and then I had this other table, which was the same logic model, but the only difference was it inserted these evaluative questions for each of those 4 pieces. So that's what you missed. Gotcha. Yeah, and the primary issue is it's hard to read all those chats along the way as we're trying, when I'm trying to, have the conversation with you. But if you would just interrupt me and say, hey, we're not seeing that, then that way I'll definitely know. If you rely on me to see in the chat, then chances are I can miss it as I did. So my apologies for that. But I will send
put it in the, I'm sorry, if they put it in the group chat, I monitor the group chat. I can't see your personal chat, but if they put it in a group, I'll be able to see it and I can let you know.
Okay, great.
Something's going on.
You can say, Alan, they're not seeing it. And I can say, okay, yep. Thanks for the heads up, because I didn't realize that. There's always a technical glitch, right? You know what I said about Murphy? Anybody here know Murphy like I know Murphy? Murphy as in Murphy's Law. Murphy and I have a very close relationship. Murphy follows me around every day of my life to make sure that my life doesn't run smoothly. So wherever I am, he's there to file something up, to throw a glitch at me, throw a curveball, so that I don't have a flawless life. And his work ethic is better than mine. He's up earlier in the morning waiting for me. And before I get out of bed, there he is, walking with me in tandem throughout the whole day, making sure that I don't have a problem-free life. So maybe some of you know Murphy, but I know Murphy very well. As in Murphy's Law. All right, other questions, comments? Anyone?
Hello, this is Natalie Ferguson. How are you?
Fine, Natalie.
I'm good, thank you. I just wanted to kind of make sure if I understand in my head a little bit. So the logic model that you were showing, the different steps that are there.
Yes.
Now, if they're the outcome, you're saying if you don't get the outcome that you're looking for based on those steps, then you look for the human a factor component, and you have to try and work on that human factor component in order not to eliminate the 20/80 Pareto principle. Because I agree with Professor Gerard that I don't think any organization would be able to run effectively, or at least have a happy, that's a simplistic word, but a happy human component if 20% is responsible for 80% of the output. Then my logic thinking is that you would have to look at the human factor component there, look at the steps in the model that you have, and try to figure out how you can minimize or eradicate that. Or am I totally off in my way of thinking, Doctor?
I think you're right on target, but there are two things we're mixing and matching here. So there's the logic model, which is a tool that puts the key processes in a context, and that's what I have on the screen right here. The logic model is comprised of, this is the general logic model template or generic template: inputs, activities, strategies, or key processes, outputs, and outcomes. Here's what the focus of our conversation today was, right here in this second column, which is these key processes. And I hope you can see that because I got the screen shared. But so for each of these key processes you identify for your service or your program that you're operating, you're going to try to improve, Natalie, you're going to try to improve the effectiveness of those processes using the steps that I laid out. And those steps are, first, you're going to identify for each process, make sure you understand it fully, which is name the process. You already have that in the logic model, the name the process. What's the starting point? What's the end point? All the steps between the starting point and end point. And then for each step, identify an outcome. That's just an extra piece you can do to help yourself. And then as you begin, so that's identifying the process. Now you're going to make the process more robust, better, so we don't rely on that 20%. You're going to go through these steps, which is really to identify the steps in the process. Remember, back here, you define the process. You already have the steps, right? So now you're going to improve that process to make it be what we call a zero defects process, or a process that approaches being flawless. So then you identify of the steps that you've laid out, those that are subject to variation due to human involvement. And for those that are subject to variation because humans are involved, you're going to add safeguards to the process so you can neutralize or nullify those human factors. In other words, if there's a part of the process that relies on me doing an independent assessment, that every time I do the independent assessment, I may not be 100% on target. So you can't rely just on my assessment. Either you got to have another person who does an assessment and have a second opinion on that, or build in some other aspect that doesn't rely on just my assessment, because that's a human piece that really relies on me doing a good job every day. And some days I may not do that good of a job. I may not feel good. I may be distracted by what's happening at home. So for those pieces in the process, those steps that rely on a human being doing something, we want to add some safeguards to those pieces that are non-human, preferably, but it could be other humans, because if you add more humans, then of course the chance for error is less. But add some strength to those pieces that are fundamentally human in how they get facilitated, so that we don't have to rely on one person having a great day. And then pilot the new process. I suggest going through this process twice, identify the steps that are subject to human variation again, add the safeguards, and then pilot the process one more time, and then tweak and implement the new process. So these steps and the ones before, which are allowing you just to identify the process, and these are the strengthening steps, are all for those key processes that operationally define the service or program that you're operating or that you work in. The logic model is just a broader context because these processes don't exist in the abstract. They exist within a programmatic context that has resources on the one end that lead to these processes or inputs or starting resources or raw materials. And then the processes result in those outputs, that 80% that Pareto talks about. We want it to be more people involved because then maybe we can get better than, we can have a better split, 50-50, rather than it being a minority that's influencing the outputs. And then of course you have the outcomes, which really are those bottom line impacts. We're all providing services at Downstate. We're all providing services to people, whether they're patients on the hospital side or students on the academic side. Those are the outcomes that we're hoping to achieve at a high quality level. We want the students to graduate and be successful practitioners. We want the patients to get better from whatever their medical ailment is and go on and live their lives. So you're right. The goal is to reduce balance the ratio in the Pareto principle as it currently stands. But some of that's human nature. I think that's almost like a fact of life. I'm not sure how much we're going to impact that. But that's debatable. But you're right. Who wants to be in a situation where 20% on the input side results in 80% on the output side? That's clearly not an efficient model. But it is what happens in much of life experience, as other folks have already attested to.
Dr. Allen.
Yes.
The
Allen's good. Just Allen. Just call me Allen. Thank you.
You got it, Allen. The way that I heard it from a banker who sat me down and taught me this sort of concept, it was very close to the Pareto principle. What she was alleging was that the way they practiced at her institution was that there were, let's say 10% were the outperformers of the group, and there were 70% that you were always trying to motivate that 70% to be 10%ers.
Right.
You're telling them, hey, listen, if you came back with more motivation tomorrow, if you did your homework, you could be a 10%er, you could be a go-to in the organization.
Right.
Then there were 20% that were at the bottom. They were the people with the poor attitudes. They were the least performing. They were the poison of the organization. Right. And what the goal is to the people who were in the 10% group, get them promotions, help them further their education, whatever you had to do to get them to continue to be leaders, to get the 70% now motivated to be 10%ers, but the 20%ers who were the bottom performers, get them out of the organization because they were holding the organization back.
Right, right.
And that's the way I learned it, which sort of seems a little similar to the, what you're talking about here, in a way. Absolutely. That there's 20% that's carrying the group, and really you should be motivating the others to join that 20%. And if they can't, then they may have to exit, your organization at some point.
Right. I thank you for adding that example. And it's very clear. I think you're exactly right. But if you think about it in terms of fundamental human nature, let's take it out of the organizational context and think about human beings in general in society. You don't have people. There's some people who are very lazy, unmotivated, and apathetic. There's some people who are very motivated, and that's a aspect of human nature that we're probably not going to ever change, Dr. Gerard. And what happens is those people are in society, but those people also have jobs. So they end up in our organizations. And so we can strive to do better, but the question is, are we ever going to do better? And I take a dim view of that. I'm not as optimistic that we will, because I think it's a fundamental nature of human beings. Some of us are motivated, high achievers, and some are not, and that's never going to change.
No, it's not about high achievers, it's about laggards. And I won't hire those people or have them work with me.
Right. But the reality is that when you go into an organization, unless you're building your own organization from scratch, you inherit people who are already there. Now,
well, yeah.
You can also help them go. Yeah, yeah,
Thank
yeah,
you.
you can, but that takes a lot of effort and that's a huge
Okay.
distraction from your mission. But yeah, you can, absolutely.
Well, if they're obstructing your mission by not pulling their piece of the action, then you got to do it.
Yeah, and there's some obvious, and there's some people who are obviously doing that, and there's people who are doing that that would not be as obvious. So, think about Downstate. None of us came into Downstate and decided 100% of the people who are on our team. We all, even President Raleigh came in and had to live with some people who are already here. He brought some people in, but obviously there are a lot more people still here before he came than who he could clean out. So the reality is that unless you're running your own business, your own company that you start, you're going to inherit some people that are going to be slackers, to use your term, Dr. Gerard, and you're not going to know it for a long time unless you spend all your time identifying that, which means you're not going to be doing anything else but that. And so I think what it comes down to is a fundamental characteristic of people in general, and those people end up in jobs. And so we have to just, to some extent, I'm not saying just have to accept it, but it is a fact of life. Some people are slackers, some people are high achievers, some people are not. And you're never going to change that in terms of human nature. And you can eliminate some people, yeah, you can fire some people, but there are people there that you won't even know who are in the category of the people you're trying to get rid of. Unless you spend an eternity in the organization and spend 90% of your time doing that kind of filtering. If your mission is to do other things, it's hard to do. It's a practical matter. I get it. In theory, yes, you're exactly right. But as a reality, practical matter, it ain't gonna change. I hate to tell you, it's not gonna change.
But Alan, what about changing the culture? I mean, a key to changing the culture is getting that 20% that's holding your organization back out the door.
Yeah, whatever that is. Yeah, right. Yes. And you can, I'm not saying you can't do some of that. I'm saying it's impossible for any one person to do it entirely. Unless you're starting your own company or organization from scratch, and you got 20 people, and you hand pick the 20 people that work with you, and they're all high achievers or whatever they are. But you come Downstate? Are you kidding me? You come into Downstate? You're gonna have who you got, and you can get rid of a few people, but there are gonna be some people who are imposters that you're not gonna know. So yeah, you're right. Yeah, but you build a culture that's conducive for making those people comfortable who are high performers and making those people uncomfortable who are not high performers. Absolutely. So maybe you'll lose some of them by having that culture that's a high performance culture. All I'm saying is that the reality in a large organization is that you're going to have some of that dead weight. You're never going to get rid of all of it. But right, yeah. So the Pareto principle is sort of a sidebar to what we're talking about today, which is the key process piece. And that I only talked about that because that's a piece of the continuous quality improvement, total quality management, philosophical underpinning or foundation. But the key to this is to really build those processes in our work settings so that they can be flawless. And the way that they can be flawless is not to rely. See, if you think about it, if you take out the human component, then you don't have to worry about whether the person's a 20% or 80% or whatever that person is. High performer, slacker, whatever he or she is, you're not relying on that because you built a safeguard in to neutralize that in the key process. So you build the processes in a way that they're robust and not reliant 100% or dependent 100% on people having a great day by building those safeguards in. And I think that's the major takeaway from today's conversation. Build the process so that it has the potential to be flawless and have zero defects by building in some additional safeguards to try to either neutralize or nullify the human factors. Because even a higher performer, a high achiever is going to have a bad day and not do as well on today as he did yesterday. And so your process is captive to that if you don't have some safeguards, and it really relies on that person having a great day. And that's sort of the key message of today. Build that process to minimize the human aspect being an aspect that functions solely because of human input. And we're a little past our time, but I love the conversation. So, we can continue or we can stop. I hate to impose more on, we're all after the usual work hours, so we want people to be able to get back to their normal after work lives. But it's been a great conversation. And anybody has any final thoughts, the floor is still open, and then we'll end.
I'll just read the two comments in the chat. One is from Donna. She said, you may have people who are in the 20% trying to get out. It's important for them to remain steadfast and become more of the solution than the problem.
Right. And to keep in mind, the 20%, the 20% could be, the idea in Pareto principle is that 20% account for 80% of whatever the output is. And the output could be good or bad, or it could be a mixed bag of good and bad. But the key concept is it's a small number who account for the output, whether they're a positive force or a negative force. Now, what did I miss in terms of that question, Franchon?
There was no, it wasn't a question. I think it was a statement. And then there's a question from Lauren. She says, what about employee job satisfaction, like good salary and benefits? That can change some of them, she believes.
Yeah, absolutely. Yes. Yes. There are many motivators that can make people better performers. Absolutely. Work environment, flexible work schedule, more money, more autonomy in one's job. All those factors really do make people like their jobs better. Typically, not everybody, typically, and have a higher probability of doing a better job. Absolutely. So if we can do those things, then we can slant the deck, so to speak, in our favor. But keep in mind, 20% may be higher or low performance or a mixture thereof. It's just the 20% accounts for the 80% of output. Whatever the mix, whoever's in the 20%. Pareto didn't say that they have to be high performers, slackers, or whatever. He just said the 20% on the input side equates to the 80% on the output side. And it's probably a mixed bag of who you have in the 20% group. But in terms of building a better are there any questions about building a better process? Building a better key process. And we know what they are in our organizations, right? We know what those processes are. We know how to identify them using the 5 steps, and then we know how to use these 7 steps to make them better. That's the goal today. Because all of our organizations, all of our services, all of our programs operate with people and key processes. Those are the 2 assets we have, the 2 commodities we have: people and key processes. That's what those are the engines that make our programs and services go. People and processes. And the key in the key processes is to minimize the people aspect. They got to be involved because nothing happens without, unless you have an organization entirely of robots, nothing happens without people being involved. But you can't have those steps in the process be 100% reliant on a person who's going to have an occasional bad day. And there goes your process. All right, so we lost most of us except for a few stragglers. Anybody have anything else you want to say? Finya and Randall, Jennifer and Jennifer. If not, we can wrap it. We can call it. See anything else in the chat, Fran? Sean?
No, sir.
All right. Thank you, everybody, for joining. Next time, what's our topic next time, Fran? Sean, let's see. It's going to be, I'm going to pull it up, I'm not sharing it with you, but it's going to be critical thinking, I think. The next lecture, November 17th, will be on critical thinking. So please think about coming to that. Each one of these topics is very different. So critical thinking, we'll talk a little bit about that on November 17th. And thank you very much for joining us today, and have a good, safe rest of your evening, everybody. Thanks. Bye-bye.